Hello, I'm Rachel. I'm one of the elderly medicine registrars working in Yorkshire. Today I'm going to do this mini gem on quality improvement. This is something we can all get involved in, making inspiring and impactful changes in our workplaces. Here are the objectives for this session. The concept of quality improvement was initially used in the industrial sector and has since been adapted to healthcare. We all know from working in these intricate healthcare systems with complex networks and pathways that there are aspects that just don't work so well and could be improved. This definition by Battledon and Davidoff describes quality improvement as the combined and unceasing efforts of everyone to make changes that will lead to better patient outcomes, better system performance, and better professional development. The emphasis here is that everyone can get involved. All members of the MDT can highlight an issue or an idea for an improvement, and as trainees we're in an optimum position to help turn these ideas into action. Our focus is always our patients, but through improving system performance and learning, we can improve patient care. So what is the difference between audit and quality improvement? Well, audit is a quality assurance process where current practice is measured against set standards. Usually a single intervention is implemented to improve the rate at which these set standards are met. Local or national guidance is often used to guide best practice. The process is often lengthy, with changes being measured over months or years. Whilst audits are really important, the changes can be easily missed on a day-to-day basis. Quality improvement allows for quicker and more evident change, which is adaptive. Multiple interventions can be quickly implemented, amended, and adapted to reflect the clinical environment and incoming data. There is constant evaluation of the project throughout, so changes can be seen in your daily working life. Choosing a topic is often the first hurdle. At times it may feel like there is so much that could be improved, it seems impossible to begin. Appreciative inquiry is a method of analysing the current systems and instead of focusing on problems and difficulties, it promotes the strength and factors that work well to inspire transformational change. Practically, this involves thinking about a system under these 4 headings. Discovery, think about what works and what is important. Dream, how could this be made better? Design, what specifics need intervention? And destiny, what is the overall hope and what would an improvement look like? Find something that's important to the whole team, and this will increase the likelihood of the project being a success. The model for improvement was first produced by Langley et al. In their document entitled The Improvement Guide. It is a commonly used model which gives a clear methodology of how to conduct your quality improvement project. The first 3 questions help design the project and set out the data and measures that will be used to demonstrate that the changes had an effect. We will look at these next. This is then followed by a PDSA cycle. Plan, do, study, act. The circular nature of this allows for multiple cycles to be ongoing and adapted. So you've now thought about your chosen topic and what you want your project to achieve. Now to focus on what is your aim. Review the current systems that are in place surrounding your chosen topic and think about what team members that are involved in the system and those you want to involve in your project. Your project doesn't have to be a large-scale system change. Even small things, like wanting to change the setup of the blood trolley to improve the efficiency of blood taking or to ensure patients have access to their call bell, can make a massive difference. There are several tools available to use to help look at your current environment or system to analyse how an improvement can be made. These can help identify the team members involved, the specific steps in the system, potential contributing factors, and potential improvement ideas. On this slide, I've put some examples of these tools. A very good way of defining your aim is to make it SMART, specific and measurable with numerical targets, achievable to give hope in making a change, relevant to allow the improvement to be appreciable, and use set specific timeframes for the project. This changes an aim from let's reduce the number of inpatient falls to let's aim to reduce the number of inpatient falls in an elderly medicine ward by 60% over the next 6 months. Next, we need to think about the data and measurements required to demonstrate improvement. How will you know that a change has had an impact? This relates to the aim of the project, but may do so indirectly. In contrast to audit, quality improvement can be used to introduce a change to those things less tangible. Yes, your project might look at something that is easy to measure, for example, the number of inpatient falls, but you can also use indirect measures, for example, documentation of the clinical frailty scale in a project that aims to improve the care of older patients on surgical wards. As part of the PDSA cycles, smaller amounts of data will be collected frequently and continuously to demonstrate the impact of interventions in real time and allow the project and interventions themselves to adapt. At the start of the project, it is important to think about what data you're going to gather, but the adaptivity of QI means that the end project might reflect very different data sets. The interventions become evident through designing the project and gathering the data. It is best to think about what change you want to make first rather than what intervention you want to implement. The interventions can be small, for example, labelling the bloods trolley or doing a lying and standing blood pressure on patients that are admitted to an elderly medicine ward, or much bigger interventions such as a policy change. What is important is that after each intervention, evaluating the impact that it has had and then use the information and data to make adaptations. This allows continuous improvement and evaluation. You can have multiple PDSA cycles running simultaneously, but be careful with this, as it may be difficult to distinguish which has contributed to change, risking continuing the interventions that are not beneficial. A run chart is a great way of demonstrating the impact your project has had. The y-axis is your measurement, and the x-axis is time. This example shows a demonstrable change. Other graphs and statistical measures can also be used. It is worth noting that some of your data may not be numerical, for example, patient and staff questionnaires. Following on from the PDSA cycles, it's important to review the project and see the impact your changes have had. This is a great opportunity to reflect with your team on how the project has gone and what to do next. From here, you can adapt the project and think about what else you may like to change, and see how the changes you have made have affected the whole environment. This may have presented with other problems or challenges, or may present with other opportunities for change. Secondly, it is important to think about how the project will be sustained and continued from here. The project can then be adapted to a different environment, for example, another ward, or if the project has not been as successful as you wanted, you may conclude the project and not continue with it. I hope today that I've demonstrated the benefit and practicalities of quality improvement to patients, systems and professional development of those working in healthcare. I hope it's inspired you to look at your own area of work and look at opportunities for improvement and discuss with colleagues and patients about what's important to them. I hope this has demonstrated that improvement doesn't have to be at trust or national level, and that whatever speciality or level you are, you can get involved in improvement and change. What seems like little changes can really make a big difference. NHS England has lots of valuable resources for you to find out more.